My name is Jill Webb from Jill Webb Training. One of the products that I offer is a range of first aid courses. And I know something that people say to me is, oh, I've had a really good day and I know I've passed, but I do feel quite worried. It's a lot to remember on a 1, 2 or 3 day course, because of course you don't need to renew your course for 3 years. So this is one of a series of short videos that recaps the main things that you need to know. We're going to think now about dealing with somebody you find who's unconscious. You'll have talked on your course about unconscious casualties being challenging because they can't tell you what's happened to them. They can't respond to you. This protocol works for anybody from age about 18 months through to adult. You'll remember on your course you'll have done a different protocol for babies up to about a year or so. We're going to work today with an unconscious adult, a male in his 30s. So, perhaps somebody's shouting me knowing I'm the first aider at work, perhaps I am walking through town, I find this person. In this case, we're in a work environment, I've been working in a different office, I walk in and I find my casualty collapsed. So, before I rush over to see what's wrong, I need to check there is nothing that is going to harm me or harm my casualty. You will have done this on your course as danger. What danger could there be? This is a lovely environment, lovely clean white floor, safe ceiling, etc. But you might not be in that sort of environment. So take a minute to look round. Is there anything that might fall on you or the casualty? Are there any trailing wires? And as you think about danger and you're looking around, see if there are any clues to what's happened. You know, is there a step ladder that's fallen over? Was the casualty trying to replace a light bulb? Is there a climbing frame? Is it a child that might have fallen off the climbing frame? And we call that history, what might have happened. The final thing before I approach my casualty is I'm going to think about my own safety in terms of bodily fluids. We don't know what might be coming out of the casualty that can harm us. I'm thinking bloodborne diseases, I'm thinking sickness, diarrhea, anything like that. So before I even approach my casualty, I've checked around for danger and I've got my gloves on. The next thing I need to do is check whether my casualty will respond to me or is alert. I'm going to feel really silly if I call an ambulance and he's just decided to have a nap after lunch. And the best way to do this is to shout quite loud at the casualty. In real life, this would be the obvious thing you do, wouldn't it? I'd shout, "Si, are you okay?" But I'm going to get a bit nearer. And I'm going to shout, "Si, Si, are you okay? Come on, if you can hear me, open your eyes." So let me just do that again, then I'm going to talk you through how that links to something else we've done on the course. "Si, Si, can you hear me? Come on. If you can hear me, open your eyes." You'll see up on the screen now the AVPU scale, which I'm sure you'll have done on your course. This is a really easy way to assess the level of consciousness of your casualty. So is my casualty alert? Clearly not. V, voice. Did my casualty respond to my voice? You'll note that I shouted in both ears in case my casualty is deaf or has a hearing problem. Then you'll notice that I shook my casualty's shoulders and I clapped in his face. The P stands for pain. Now don't get it carried away. If this is a work colleague you don't like, this is not a chance to give him a good slap. But we're applying some pain, shaking of the shoulders, clapping in the face is particularly effective for children. And the reason we're doing this is to see whether somebody that can't respond to a voice and a simple command can respond to pain. So we've established that our casualty is unresponsive. He's not responding to voice, he's not responding to pain, he is unresponsive, or what you may have heard called unconscious. So now we know that our casualty is unresponsive, we're going to shout for help. We don't want to be leaving an unresponsive casualty just laid there, and at the moment we're by ourselves. So, help! Can somebody help me? If you work in an environment like a school, many organisations like a code word, rather than all the pupils getting panicky, you might shout code A or code red, some agreed, recognised symbol that you need help. So once I've asked for help, I'm going to see if the casualty's breathing. So if you think of where we are on our protocol, which will come up on screen a little later, you might remember Dr. ABC. Danger we've done, response we've done. We're now going to think about airway. The first thing I'm going to do is open the airway. The reason for this is the tongue is the largest muscle in the body. And when we lose consciousness, our tongue relaxes and often slips back into our throat. So what I'm going to show you is the position that I'm going to try and achieve on my casualty. Have a go at this. Put your chin onto your chest. Breathe 3 or 4 times like that. And now, tip your head back as far as you comfortably can. Can you see? I really want to be able to see that windpipe. You should find it much more easy to breathe this way when your head is tipped right back. And the picture that's going to come up on the screen now will show you what happens to the tongue when the head is tipped right back, how it clears that airway. So, to do this on my casualty, it's a 2-part process. It's called a head tilt chin lift. I take my hand nearest the casualty's hairline and I put it on their forehead. I take my other hand and I need to get my thumb and 2 fingers. Just if it helps you to remember, imagine making a shape like you might have done when you were younger. Take your thumb and put it on their chin, near their lip, and take the 2 fingers and put it under their chin. So I'm then going to tip back the head and lift up the chin. And can you see straight away how the casualty's windpipe is extended? So that's the airway. Danger, responsiveness, airway. B is for breathing. So I'm going to maintain my head tilt chin lift. I'm going to look down the casualty's body. I'm going to look, listen and feel for 10 seconds. I'm looking down the body, where in this casualty I can see breathing. I'm listening to see if I can hear breath. And I'm keeping quite close because in the cold weather particularly, you might be able to feel that the casualty's breathing. So look, listen and feel for 10 seconds. So I've now established that I've got a casualty who is breathing but not responsive. The next thing that can kill this casualty is a life-threatening bleed. Now we're not talking about a bleed which is just, they cut their hand as they fell. We're talking about a bleed which is life-threatening, a large quantity of blood. We will normally see that. If the casualty is lying here and there's a lot of blood coming out of legs, arms or torso, I will probably see it. But I'm just going to do a quick check to make sure there's not blood anywhere I can't see. So there's not blood pooling behind the neck. I can look at my gloves to see. There's not blood pooling behind the back. No. Behind the knees. No. Might look in boots if they're there. The other place that I often get asked about bleeding is internal bleeding, because obviously you can't see that. One way you can test for this is to draw a cross on the casualty's tummy. Straight across with their tummy button at the centre. Take 3 fingers and gently squeeze their tummy. Most of our tummies, even if we're quite fit, are quite squidgy, and that's good. If you feel really, really solid mass there, really swollen, you might be querying internal bleeding. So, we've thought about danger, we've thought about responsiveness, we've checked the airway, we've checked for breathing. C, we check for a life-threatening bleed, is it circulating all over the place? So what we're going to do now, hopefully, is just stay with our casualty until help arrives. However, if we have to leave our casualty because we're the only people there and we need to go and summon an ambulance, we must put them in what's called the safe airway position. You may have heard of this called the recovery position. And the way to do this is as follows. You take your hand and you take the casualty's arm, which is nearest you, and put it up as high as you can. Don't force it, it will depend on their age, their flexibility, etc. You then take your hand, which is nearest the casualty's head, you lean over and you grab the casualty's hand. If you've got it right, if you get your casualty to wiggle their fingers for you, You've made a little butterfly. I'm then going to take the back of that hand of the casualty and put it on the casualty's cheek. I can then use my hand there as a bit of help. I'm then going to bend the casualty's knee to help me roll them over. You'll see here I can't reach their knee, that's fine, I use their jeans. I need to hold on to that knee because once I've got it, if he's unconscious and I let go, it will flop again. I'm then going to roll the casualty gently towards me. I can feel here the centre of gravity goes. I keep hold of the head and I first of all sort out the leg. I pull the leg right up. I'm then going to let the head go and see where it lands. What I'm trying to achieve here is a stable, open, draining airway. And there will be two pictures on the screen now which will show you correct airway and an incorrect airway. And if we look a bit more closely at casualty, this is another really good example. So I've rolled the casualty over. If I was to leave the casualty like this, and if he was sick, he's very likely to choke on his vomit. So what I'm trying to do is move his head just to that tilted angle so that it's stable. I'm going to open his mouth, draining, and I can leave him. So you might have something around. I've managed to find a jumper that I had. And I'm not stuffing the whole jumper under the head. I'm simply making a bit of a wedge with it. And as I do that, you'll see the change to the angle. So you can see now, I might even put a little bit more up. You can see now that that airway is stable. If I open it, if he's sick, it will go down onto the floor. If you've got this right, when your casualty opens their eyes, they should be looking at about 45 degrees to the floor. This is the bit that's important. It doesn't matter if you get the hands and the legs muddled up. Get the casualty on their side with a stable, open, draining airway. You can then leave the casualty to go and call for help. There may be other times that you use the safe airway position. For example, if a casualty is struggling to breathe, you may decide actually they seem to be breathing a bit better on their side. But you must always use it when you leave the casualty. So up on the screen now, you will see Dr. ABC, the reminder of this sequence. And you will also see this as ABC for those of you that may have learnt it that way. Both are right, just use whichever one resonates with you best and you find it easiest to remember and you think will be stuck in your mind for an emergency. Don't forget what I'll have said on the course. I hope you never have to use this. If you do, it might not be for another couple of years. So look through this video again, go through the steps yourself and really get it embedded in your memory. Thank you.